After a series of virus infections found in the Chinese capital ahead of the start of the Winter Olympics, people in a district of Beijing were ordered to undergo mass coronavirus testing. Similar testing has also started in multiple neighborhoods of other districts in Beijing. The government told people in areas of the Chinese capital deemed at high risk for infection not to leave the city after 25 cases were found in the Fengtai district and 14 elsewhere. As Beijing prepares to open the Winter Games on February 4th, the ruling Communist Party is stepping up enforcement of its zero-tolerance strategy aimed at isolating every infected person. The Olympics are being held under strict controls meant to isolate athletes, staff, reporters, and officials from residents. After arriving in China, athletes from across the globe are required to be vaccinated or undergo quarantine. As of Monday, China reported 18 new cases of local infection, including 6 in Beijing, with current infections reaching over 2,700 cases. While nearly 9.5 billion doses of Covid-19 vaccine have been administered across the planet, less than 10% of low-income countries have received a dose, but that's about to change.
Expected to be available beginning in February, courtesy of mega medical manufacturer Biological E Limited, based in southern India. India's health minister announced its emergency approval in December. By then, Dr. Maria Elena Battazzi and Dr. Peter Hortez, co-directors of the Texas Children's Vaccine Center in Houston, Texas, had been working with BioE for nearly 2 years to create the vaccine using existing technology.
What this new vaccine technology brings to the table is the large quantity of production that we can produce, right? You know, we're talking Biological E in India already mentioned they could do 100 million doses a month. It can raise a little bit the confidence of using this type of vaccine because this is a conventional technology.
New Delhi has already ordered 300 million doses. Manufacturers in Indonesia, Bangladesh, and parts of Africa are also in discussions to produce Corbavax. Dr. Elizabeth Mack leads the Pediatric Critical Care Unit at the Medical University of South Carolina.
There haven't been diseases of this proportion that were controlled outside of vaccination efforts. So certainly really excited.
So this is,
Public health officials say immunizing more people with a more effective vaccine is critical to preventing additional variants from developing. Dr. Maria Van Kerkhove of the World Health Organization.
So it is very unlikely that Omicron will be the last variant you'll hear us speaking about. This is why it is so critical that we focus on getting vulnerable populations around the world vaccinated and that we increase vaccination coverage in all countries.
Millions across the developing world have received China's Sinovac or Sinopharm vaccine. Both have proven to be less effective against the Delta variant and Omicron. Dr. Battazzi says Corbavax could provide more long-lasting protection.
I think it can fill that gap because we're already seeing that individuals who participated early in 2020, they are being followed many months later. They still have a very durable immune response.
Still, Corbavax has drawbacks of its own. It can't be modified as quickly as mRNA vaccines, and just like existing vaccines, it will not prevent COVID-19 disease completely or its spread. It also has yet to be approved by the World Health Organization for distribution through the Global Vaccine Initiative, COVAX. But with each step towards more jabs and more arms, public health officials say we will be closer to a world with more immunity against COVID-19.